Well, you're most welcome, everybody. It is Sunday the 15th of March. Is the world blind? Here in Lombardy, people are dying, and we are only at the start. Nobody is helping. Nobody is taking precautions and quarantine their country. It's going to get way more ugly the longer governments wait. Extreme lack in the media of trustworthy sources. The actual information for the population all over the world media in Italy were saying that everything was good and the epidemic was just a few areas before shutting down the whole country. That's an email I got from Italy just a few days ago, imploring other countries to close things down before they got to the state this person is seeing in Italy. And the result at the moment is patchy. Some places are, some places are not. But that's a rather poignant email from Lombardy in the north of Italy. Now, if you've been following these videos, you know that we have trustworthy sayings, worthy of full acceptance. And I'm formally introducing a new one today, and it's flatten the curve. Now, what do we mean by this flatten the curve? Well, here we have a graph I've just drawn up. And what we have here is the number of cases along there. So that's the number of cases going up there, increasing number of cases. And here we are today, we're at the 15th of March today. I drew this yesterday. And then after that, we've got April, May and June. Now, what is going to happen without interventions, I believe, is that the curve is going to go up rapidly with doubling and exponential growth in numbers. And this could well be the case in my country where there's a very limited shutdown at the moment. So here we are now, we've got a certain number of cases. And this can go on rising really quite dramatically like this. And it will probably reach a peak somewhere in June, something like that. But then by that time, so many people will be infected, there'll be less people left to be infected. And the numbers will start to drop off. And we'll get this curve. But this is actually quite a steep curve. Now, why does this curve matter so much? Well, the reason this curve matters so much is that we have limited healthcare resources. That's why it matters so much. So the limit of our healthcare resources will be exhausted. So what that means is, that's the cases, they're the dates, that's the number of people infected. But our ability to treat people at any one time is going to be here. That's the amount of healthcare resources that we have in the country to treat people. It's going to be there. So if we can only treat people up till there, what do we do with these people here? All these people here that get sick when the full capacity of the health service has been exceeded. Now, of 100 people that get this disease, 100 people get it, about 12% are going to be quite ill and need some form of healthcare, but about 5% are going to be critical and need quite sophisticated healthcare, such as intensive care and ventilation. But if the curve rises dramatically like this, then even that 12% who just perhaps need some additional oxygen or some intravenous antibiotics or some intravenous fluids, it might be difficult even to help that number if the curve rises dramatically. Hence, we need to flatten the curve. So what we need is, if we look at the curve here like this, so what we've got here is another graph. And here we have 14th of March till the 14th of March next year. Now, what we want to achieve is, and remember, this line here is our ability to cope in terms of healthcare provision. So that would be about here like this. So that's our ability to cope with the number of sick people all at one time. if a lot of people get infected all at the same time, we're going to go over that, and we're not going to be able to treat a group of people. And let's not euphemize this. Basically, that means a lot of people are going to die. There's no point beating around the bush. If we can't support these people, the death rate is going to be high. It's really that simple. So what we need is a curve. And remember, that was on a that's on a 3.5 month scale. Well, this is on a year scale. So what we need to do is make sure that the curve grows slowly, like this. Now, I don't know when it'll peak. And in a sense, it's less important, because with this, a lot of people are going to die. But if we can lower this curve out, yes, it's going to take longer. And we might still have cases this time next year. But then in 2021, there's a very good chance we're going to have an effective vaccine. And that will cut this pandemic short. So this is what we need to achieve, because this is what we don't want. Now, bearing that in mind, let's look at some news stories from around the world and think about how this is going to probably pan out in practice. So we're on the 15th of March. Now, one of the problems here is a country is going to be as strong as its weakest link. So what are the weak links in your country would be a question to ask. Now, because if we have a country and then there's a cluster of cases, that could be a source of spread. Now, we might be able to isolate clusters, of course, but it could certainly be a source of spread. So this is a worry. So what are the weakest links? So institutions, for example, care facilities, prisons, dormitories. And I must say, I'm particularly worried about prisons in poorer countries where there's extreme overcrowding. And I'm also worried about prisons in the United States where there's a very extensive prison population. So both quite major concerns, really. And it's amazing to think that we're only 10 weeks into this pandemic. 10 weeks ago, COVID-19, coronavirus disease 19, was a term that didn't exist. And coronavirus was an academic curiosity. Now, Kenya, Ethiopia, Sudan, these African countries have now all reported cases. They've all reported cases. And I've been talking to contacts in Kenya, and there's a myth that because there was no cases there, they believe that Africans, black Africans, couldn't get this disease. Well, let me assure you, it doesn't matter what colour you are, it doesn't matter what country you come from, if you're a human being, you can get this disease. So this is completely untrue. Africans are just at risk from this disease as Chinese, as English, as anyone else. We are all the same race. So this is the sort of dangerous information, disinformation that can be around. Now, these have all had the first cases. Now, just to illustrate the point here, Kenya has got 0.2 doctors per 1,000 of the population. Ethiopia has got 0.1 doctors per 1,000 of the population. That's one doctor per 10,000. In other words, Ethiopia's got a very weak healthcare system and Kenya's got a pretty weak healthcare system as well. And the awareness in the population in these countries is not high at the moment. So that means when the virus starts spreading in these countries, it will spread quickly and extensively. And the 12% that get ill and the 5% that become critical are going to struggle to find treatment. Or to put it another way, they're not going to get treated and they're going to die. So it's just a massive concern, massive concern. Now, South Korea, cases at just over 8,000 now. So South Korea has done a pretty good job on this, really. South Korea has reduced the number of new cases quite significantly. And they've done so by very comprehensive testing. A lot of contact tracing and isolating all the cases. Quarantining areas and whole areas and even cities if necessary. Ensuring social distances. They've taken a comprehensive approach as recommended currently by the World Health Organization. And whether that could happen in these countries, well, it wouldn't happen in these countries anything like as it happened in South Korea, unfortunately. Now, moving on to the situation in the United Kingdom, my country. Now, a couple of days ago, I posted a video describing the thinking of the British government on this crisis, and received quite extreme criticism for doing so. And I understand that, because we did show yesterday, when we clarified things, that there was grave inconsistencies between the advice of the World Health Organization, what's happened in China, what's happened in Korea, what's happened in Hong Kong, what's happened in Taiwan, Singapore, to what's happening in the United Kingdom. We noticed grave inconsistencies there. So the report from the UK is 1372 cases, 35 deaths. That's a 2.5% death rate. Now, I'm not going to pretend I'm not concerned by this death rate. I am concerned by this death rate. It's very high. Now, just in comparison to the 0.1 doctors per thousand of the population in Ethiopia, in this country, which is fairly typical for a European country, there's 2.8 doctors per thousand of the population. But in the whole country, we have 5,000 ventilators. And remember that 5% of those that get infected might need these ventilators. So if 1 million people get infected, I make that as 50,000 ventilators we would need, not 5,000 ventilators we would need. So the government has called for more, and it said all the ventilators that the manufacturers produce will be bought. It's called for people to go into a war footing to manufacture ventilators, to switch production from whatever you're making to ventilators. We're going to need an awful lot for this 5% of critical patients. And as well as that, we're going to need an awful lot of oxygen, because remember, 12% of patients can be quite poorly with this and perhaps require supplemental oxygen. And that's actually quite a large proportion. Now, there is some panic buying in my country, but I haven't seen any in my city. So far, everything's been very ordered. Panic buying has been shown on TV, but I think the TV cameras kind of go to the places where there is this panic buying and try and make a bit of a fuss about it. I haven't seen it. Now, the government is saying that over 70s might need to self-isolate in future. They're not doing it yet. In future, they're saying. And when they self-isolate, it's going to be for about 4 months, probably. And this group, of course, is at increased risk. They're talking about emergency powers next week. So do you get the impression there's sort of reactivity rather than proactivity here? And they're talking about mass gatherings may be banned. I mean, we should have done this last week. It's a little bit reactive. Quite a lot reactive, in fact. But it's what we've got at the moment. Now, Poland, on the other hand, with 103 confirmed cases, and Latvia with 26 cases, have closed their borders. So that's really quite proactive, even though there's a small number of cases. They've closed the borders, people can't go in and out. As far as I know, they're enforcing that. And that means they should be able to mop up these clusters and hopefully eliminate the virus from their country.